Do you consent with me doing the video?
Yes, I do.
Okay. Hello, my name is Karlee. I'll be your student nurse today. Can I have your name and date of birth, please?
Brenda Cannington, May 12th, 1949.
Okay, can I see your wristband?
Yes.
Alright, thank you. So today what I'm going to be doing is performing your head to toe assessment. I'm just going to be assessing all the different body parts, making sure they're functioning properly. Is that okay with you?
Yes, it is.
Do you have any questions for me?
No, I don't.
Alright, I'm going to start off with the head. Upon observation of the head, it is normal cephalic, midline. Now I'm going to palpate. You let me know if there's any pain or tenderness, okay?
Thank you.
Any pain or tenderness?
No.
Alright, no pain or tenderness noted upon palpation of the scalp, and there are no masses or lesions noted. Next, I'm going to do some palpation of your sinuses. You let me know if there's any pain or tenderness as well, okay? Frontal sinuses, maxillary sinuses. Any pain or tenderness?
No.
No pain or tenderness bilaterally of frontal and maxillary sinuses. Next, I'm going to assess your facial features of your movements. So if you could wrinkle your forehead for me. If you could shut your eyes for me. You can open them. Smile for me. Okay, can you clench your teeth? Alright, and puff out your cheeks. Okay, facial features are symmetric at rest. Facial features are symmetric bilaterally with movement, and they are smooth. Cranial nerves 5 and 7 are intact. Next, I'm going to assess your nose. So, on observation, the nose is midline, and can you look up for me? Okay, perfect. And then you can look down. Nose is symmetric, and what I want you to do is occlude your right nostril and breathe in for me. And breathe out. And then the other side, breathe in, and breathe out. And bilateral nares are patent. Next, I'm going to assess the mouth. So if you would open up wide for me. Alright. And can you lift up that tongue? Okay, perfect. And then I'm going to grab my tongue depressor over here. I'm going to have you open your mouth for me, stick out your tongue, and say, ah. Alright, perfect, thank you. And then I'm going to also elicit a gag reflex, okay? So just open up. Okay?
Yes.
Okay, thank you. And then also, can you swallow for me? Perfect. Alright. Patient's buccal mucosa, soft palate, hard palate. Uvula, tonsils are 2+ and symmetric bilaterally. The tongue is present and all locations are pink and moist. And there are no masses or lesions noted. Dental caries, your teeth are white and of good hygiene, and there are no dental caries noted. Upon elicit of the gag reflex, it is intact. Patient swallowed without difficulty and upon command. And upon, can you also state for me light, tight, dynamite?
Light, tight, dynamite.
Okay. Upon stating light, tight, dynamite, patient was able to do so without difficulty upon command. Cranial nerve 12 was intact, and then upon swallowing and with the gag reflex, cranial nerves 9 and 10 were also intact. Alright, next I'm going to move on to your eyes, okay?
Okay.
So I'm just going to first look at your eyes. Upon observation, there is no scleral icterus noted, no protrusions noted as well. So I'm going to have you look at my pen light and follow my pen light with only your eyes, no movement of your head, okay?
Or drainage or discharge is tympanic membrane was translucent and peripheral. Upon palpation by lateral artery.
Alright, perfect. Patient followed through with all 6 fields of gaze with no deviation, no nystagmus was noted. Next, I want you to look over to my right shoulder. Just look at this curtain for me. When I introduce my light, I want you to follow it in, okay? Patient accommodated to a distant to near object without deviation, and accommodation was noted. Next, I'm going to assess your pupils, so excuse this bright light, okay? So I'll shine my lens. patient's pupils were 5 millimeters bilaterally before introduction of light. Patient's pupils constricted to 3 millimeters bilaterally when introducing the light. Cranial nerve 3 is intact, and then 3, 4, and 6 cranial nerves were also intact when looking at the 6 fields of gaze. And then also the pupils were round, equal, reacted to light and accommodation, and like I stated, cranial nerve 3 was intact. Alright, next I'm going to now observe your ears, okay? So if you could just put your hair behind your ears for me. Thank you. Alright, I'm going to palpate. You let me know if there's any pain or tenderness, okay? Any pain or tenderness? Alright. No pain or tenderness upon palpation of the ears, and upon observation of the ears before palpating. There was no erythema, there was no crusting, no drainage noted bilaterally. And then now what I'm going to do is I'm going to do the whisper test.
Okay.
So I'm going to have you close your left ear for me, and I'm going to whisper a set of words and you repeat them back to me.
Cat, hat, mouse.
And then close your right ear for me.
Pink, green, orange.
Patient correctly identified 6 whispered words. Cranial nerve 8 is intact. Next, I'm going to do a test called the Weber test. So I'm going to take this little tool, I'm going to ping it on my hand and hold it on the top of your head. You let me know if you hear the sound in one ear better or if you hear them equally in both, okay?
Okay. Equally in both.
Okay. Sound is heard equally in both ears. There is no lateralization noted. Alright, next also I'm going to have you taste this for me. If you'll close your eyes, I'm going to have you hold out your left hand. I'll put this in your palm. You tell me if it is sweet or sour, okay? Was it sour? Okay, you can spit it back out for me if you want. Okay?
But it was really
Patient was
good.
able to correctly identify sour taste. Cranial nerve 7 is intact. So next, I'm going to also have you close your eyes for me one more time.
Okay.
I'm going to have you occlude your right nostril. So hold your right nostril for me. And if you'll tell me what this is. Okay? It's right there at your nose.
Alcohol swab.
Okay? Can you close your left one as well for me?
Oh, okay.
And breathe in and out.
Alcohol swab.
Okay? Patient correctly identified taste. Cranial nerve 1 is intact. I'm going to wash my hands since I touched the trash can.
Okay.
Alright, now I'm going to grab my otoscope and I'm going to look inside your ears, okay?
Okay.
Alright, I'm going to pull the pin up and back.
Okay.
Pull the pin up and back. Thank you, Miss Kennington.
You're welcome.
Okay. Upon observation of the bilateral auricles, the bilateral auricle external ear canals had no excessive cerumen, no crusting, no arrhythmia, no foreign bodies, no excessive cerumen present. The tympanic membranes were intact. Bilateral ear canals were patent, and the tympanic membranes were transparent and pearly gray in color in both ears. And the cone of light in the right ear was at the 5 o'clock position. Cone of light in the left ear was at the 7 o'clock position. Next, I'm going to move down to your neck portion.
Okay.
So I'm just going to palpate. You let me know if there's any pain or tenderness. Did you see pain or tenderness? No pain or tenderness upon palpation of the trachea, and the trachea was midline. Next, I'm going to also take your carotid arteries. So I'm going to first palpate and locate. Okay, perfect. Carotid pulse is 2 plus, even, and regular. And now I'm going to also take, what I want you to do is I want you to breathe in, exhale, and hold for me. And when you do that, I want to also take with the bell of my stethoscope.
Okay.
Breathe in, exhale, and hold. Okay, Miss Cannington. Same thing on the other side. Breathe in, exhale, and hold. Upon auscultation of the carotid arteries, there was no bruise noted bilaterally. Alright, next what I'm going to do is I'm going to do your respiratory section. So I'm going to just check. AP to transverse ratio is 1 to 2. Chest is symmetrical with no deformities noted. Breathing is normal and symmetrical with movement. Next, I'm going to also take your lung sound. So if you would just turn your legs left for me. But first, before that, I'm going to check for your lung expansion. So if you could take a big deep breath in for me and out. Okay, posterior lung expansion is symmetric bilaterally. Alright. Next, every time I move the diaphragm of my stethoscope, I want you to inhale and exhale for me, okay? Inhale and exhale. Perfect, Miss Carrington. You can come forward for me now. Thank you so much. I'm going to do it from the front side. Okay, inhale. Exhale. Inhale. Exhale. Alright, and if you could move your breast tissue to the left for me. Inhale. And exhale. And if you'll move your breast tissue to the right. Inhale. Exhale. And then if you'll lift it up. Perfect. And on the other side. Okay. Posterior and anterior lung sounds were normal and smooth. There were no adventitious lung sounds noted bilaterally. Alright, next I'm going to also get your capillary refill. So what I want you to do is hold your hands out like this for me. Cannot do my patient's capillary refill. She has fingernail polish. Alright, I'm going to take your shoes off.
Okay.
Okay, capillary refill is less than 2 seconds and the lower extremities was not able to notate the upper extremities. It was equal bilaterally. Right now I'm going to assess your cardiovascular. So I'm going to also take each different valve, okay?
Okay.
Aortic valve is second intercostal space right of the sternal border. The pulmonic valve is second intercostal space left of the sternal border. If you'll move your breast tissue to the left for me. Tricuspid valve is left of the sternal border, fifth intercostal space close to the sternum. Can you move your breast up for me? Mitral valve is fifth intercostal space left of the sternal border, mid-claviculi. Alright, next what I'm going to do is I'm going to have you lie down for me. We'll move on to your abdomen. Breathe out for you. So what I'm going to do, Ms. Cannington, is first I'm just going to inspect, and then I'll also take And then I'll move on to percussion and palpate, okay? On observation of the abdomen is flat. The umbilicus is midline. Next, I'm going to auscultate. Normal active vowel sounds are heard in all four quadrants of the abdomen. Next, I'm going to percuss. Okay, timpani is heard in all four quadrants of the abdomen. Let me know if there's any pain or jitteriness. First, I'm going to go to soft palpation, then move into deep, okay? Any pain or tenderness? No. Alright, I'm gonna move into deep, okay? Any pain or tenderness? Alright, no pain or tenderness upon palpation of soft and light in all four quadrants of the abdomen. Alright, I'm going to assess your pulses. So can you hold out your hands for me? Uncross your legs. You're fine. Okay, brachial, radial, posterior tibialis, dorsalis pedis. All pulses are 2+, regular and even in the upper and lower extremities bilaterally. So next what I'm going to have you do is I'm going to put back on your shoes.
Thank you, baby.
I'm going to have you stand up for me. This is fun. Alright. Can you step down for me? Yep. So I'm going to now do the Romberg test. So what I want you to do is just stand, open your eyes for me for 30 seconds. 30 seconds is fast. So close your eyes for me. 30 seconds is fast. Negative Romberg test is noted. Alright. So next I'm going to have you hop on one foot. 1, 2. Alright. And then the other side. 1, 2. Alright. Patient is able to hop on one foot bilaterally. Any pain or tenderness?
No.
Alright. No pain or tenderness, no crepitus or limitations noted. Next, I'm going to test your range of motion, okay?
Okay.
So can you look down for me? Can you look up? And you can look to me. Turn your head to the left. Turn your head to the right. Alright, left ear to your left shoulder. Right ear to your right shoulder. Alright, perfect. And then if you could, do your left. That's fine. Alright, and then the other side. Okay, and then can you twist your spine like this? Okay, the other side. Alright, and then can you touch your toes for me?
Sure.
Okay, can you lean back for me best as you can?
Yep.
Perfect. Alright. And then I'll have you flex your foot like this, bend it, and then extend.
Wait a minute.
You got it. Bend, extend, and then the other one. Bend, extend. Perfect. Alright, and then if you're holding your arms out like this, palms facing up, flex, and extend. Alright, perfect. Range of motion in arms, neck, spine, and legs are, did you have any pain or tenderness?
No, I didn't.
No pain or tenderness in those. Patient had no difficulty performing movements. Alright, and then what I'll also do is I'll have you sit back down for me.
Okay.
Alright, and then I'm going to test your muscle strength.
Okay.
Can you squeeze my hands as hard as you can? Alright, perfect. And then I'm going to push down and you push up with your feet. Alright, and then I push down, I'll push up. Okay, muscle strength is 5 out of 5 bilaterally in upper and lower extremities. We're going to do the same things with your shoulders, okay? So I'm going to push down, you try to resist my pressure, okay? Okay, Patient's shoulder strength is 5 out of 5 bilaterally, and cranial nerve 11 is intact. Next, I'm going to now assess your light and dull touch. Alright, so you tell me if you feel sharp and dull. This is sharp, this is dull, okay? You can close your eyes for me.
Sharp. Sharp. Dull. Dull.
Close your eyes for me.
Sharp.
Okay.
Sharp.
Patient is able to correctly identify between sharp and dull touch in upper and lower extremities bilaterally. Next, I'm going to do our last test, which is going to be, I'm going to let you hold out your left hand, just this hand for me, and if you'll close your eyes for me, I'm going to place a familiar object in your hand, and I want you to tell me what it is, okay? You can,
A coin.
okay? And then you can put that hand down and the other hand up. Okay, you can close.
Oh, that's the gym clip.
Okay, perfect, thank you. Patient correctly identified object in both hands and stereognosis is intact. Next, I'm going to assess your skin. Skin is congruent with race and ethnicity. Stigmatization is thorough in upper and lower extremities. Now I'm going to palpate for your skin temperature, okay? Okay, skin is warm and dry to touch in upper and lower extremities. All right, Ms. Keaton, do you have any questions for me today?
I don't.
Okay, I'm going to go assess your chart, okay?
Okay, thank you.
Ms. Kennington, I forgot to do one more thing on your head to toe, okay?
Okay.
I'm going to assess for the red light reflex. It's going to be a bright light, okay? So I do apologize. Red light reflex is intact bilaterally. All right, Ms. Kennington, thank you so much. Do you have any questions before we
No, I
end today?
don't.
Okay, thank you.
You did good, thank you.